Welcome back, everyone. 9:12 on the clock. So while COVID may not be top of mind for most Americans, it is still present, no doubt about that. Health experts say it's important to keep that in mind as you make those summer plans and head off to those summer gatherings. Here to discuss, Dr. Dale Bratzler, OU Health's Chief COVID Officer. Dr. Bratzler, good to have you in studio. We're so used to, for 2 years, chatting to you behind a Zoom camera. So this is
absolutely.
Really nice.
It's great to be here.
Good to see you. So let's talk about COVID here and where things stand here in Oklahoma. It seems like COVID has kind of gone to the back of everyone's minds. Nobody seems to pay attention to it anymore, but it's still a real threat here.
Yeah, COVID is still here. It's not gone away. We're still seeing 150 to 200 people a day that are getting infected that we know about. We don't know of all the tests that are being done by people at home, but people are still getting infected with COVID-19. The good news is that hospitalizations in Oklahoma remain quite low from COVID-19, and a lot of people are getting infected, but they've already been vaccinated or had infections in the past, and so they're not getting as sick with the subsequent infections that they're getting.
That is good to see. Are there any hot spots here in our country right now or in our state?
Yeah, so in general, most of Oklahoma is in the green zone. There are a couple of counties out in far western Oklahoma that have a little bit higher rates of spread of COVID-19. But in general, if you look at the CDC's transmission map, Oklahoma is mostly green now, so that's good news. In the United States, if you're thinking about travel this summer, right now, if you look at where rates are the highest per population, in other words, your chance of running into somebody who's infected, the highest rates in the nation are in Puerto Rico, the U.S. Virgin Islands, and in Hawaii, interestingly.
Wow.
All destinations that people like to go this time of year.
Vacation spots, no doubt about that. So people have to be very vigilant when they go to those places. What do you want them to keep in mind if they are traveling to one of those hot spots or just traveling in general this summer?
So I think it's really important. I'll be traveling in a couple of weeks, and I'll be on a plane. And I don't know where all of the people on that plane come from. Because remember that in the United States, in the continental United States, still the northeastern United States, Michigan, Wisconsin, now the Appalachians, and California, rates are still higher than they are, much higher than they are in Oklahoma. You don't know who you're sitting by in the plane, you don't know. So I still encourage people to first make sure you're vaccinated, and that includes the original 2 doses of the vaccine plus at least 1 booster dose. And then I will wear a mask when I'm on a plane in tight settings where you simply cannot separate yourself from other people, because if you're sitting close to somebody, it's almost impossible not to breathe some of the air that came out of their mouth.
Because the thinking here is a lot of people think that if you're on a plane, the air filtration systems, the way the airflow works, you should be safe. But you're saying you should probably wear a mask just in case anyway.
I think so. So I think the airline industry has done a good job of improving ventilation on airplanes to try to reduce the spread of respiratory viruses. But part of the problem is that if you're sitting in that middle seat or you're right by somebody in the middle seat, I don't care how good the ventilation system is, there's still a chance that you're going to breathe some of the droplets or aerosols that come out of that person's mouth.
You mentioned booster shots there. For a lot of folks, it's been 6, 7, 8 months since they got their booster shots. Are we getting to the point now where folks need to consider getting another booster shot? What does the science say here?
Yeah, so first, here's the good news. CDC published a very nice study that went all the way through the Omicron surge. And what it showed was that if you'd had 3 doses of the RNA vaccines, in other words, the original 2 plus 1 booster, it remained more than 90% effective at keeping you out of the hospital, out of emergency rooms and other settings. So the vaccine works very, very well. There are some people who we now recommend getting a second booster dose, and that's people above the age of 50, people who have underlying medical conditions that would put them at greater risk of complications of COVID-19, and certainly anybody that's immunosuppressed, because those people do have greater risk of complications if they get infected.
Okay, so for people that are generally healthy, another booster shot, not necessarily in the cards right now.
Not necessarily. I mean, I don't know of any reason that it would hurt you, but it's not currently recommended or FDA approved at this point.
Gotcha. How important is it for parents to get their kids vaccinated? Vaccines are more widely available to kids now. How important is it for parents to take that step?
Yeah, so we know that kids, though they don't get nearly as sick most of the time, they can, but most of the time they don't get as sick as adults do with COVID-19. They can spread the disease. They can spread it to grandparents, siblings, parents, other people that are older. Perhaps you have somebody in your family who is immunosuppressed or on cancer therapy. So it's important that the people around them be vaccinated, and so that's why I recommend it for children. Right now, schools are mostly out, but I would certainly think about vaccination before the school year starts, because we know that COVID-19 spreads through schools, daycares, and other places.
How close are we to having a vaccine for kids under 5?
So we actually do now have an approval for kids that are above the age of 6 months to 5 years of age. So we do have that FDA approval, or at least authorization now.
Okay, that authorization is in there. As we just look ahead to the rest of the year, what is the outlook in terms of COVID here in our country? Is it finally endemic? Are we finally at that stage where it's just kind of a part of our lives here?
Well, I tell all the medical students I work with that for the rest of their career, when a patient comes in with a viral-like illness, they're going to have to consider COVID-19 in the differential diagnosis. It's not going to go away. We cannot eliminate this particular virus based on current science. So whether we're endemic or not, the World Health Organization has not ended the pandemic at this point. It is still spreading rapidly in parts of the world that are under-vaccinated, and that's one of my big concerns going forward. Will we see a new variant like Omicron that came out of South Africa? Will we see that happen from some other part of the world, a new variant that spreads rapidly in our country? Very difficult to keep viruses out with borders. It just doesn't happen.
But all in all, we're in a better place now than we were a year ago, for sure, correct?
Absolutely. So two big reasons. One, we have vaccines. They're very effective. They're incredibly safe, and they're very good at you may still get COVID, even being vaccinated, but if you do get COVID, you're not likely to end up in the emergency room in the hospital. So that's the good news. Second, we now have effective antiviral treatments for patients who do get infected, who are at greater risk of complications. So somebody that's unvaccinated that gets infected, we can give them drugs like Paxlovid or Molnupiravir or the IV Remdesivir. We have a variety of antiviral medications that can actually reduce the complications of the disease.
All right, good to see those treatments, and that hope is out there on the horizon. Dr. Brassler, we appreciate your time as always. Thank you so much, sir.
My pleasure.